Hi, this is Dr. Bharadwaz. I am a homeopathic doctor. Today we will discuss on the topic of gastritis. What is gastritis? Gastritis is the inflammation of stomach mucosa. Stomach mucosa is the inner part or inner layer of stomach. When that get inflamed, it is gastritis. It results in the symptoms of gastritis. What are the symptoms of gastritis? Sometimes it is asymptomatic. When the gastritis is due to infection of Helicobacter pylori, it is asymptomatic. The common symptoms include pain in epigastric region, abdomen region. It may be reflected in the form of chest pain, or it may be reflected in the form of increased saliva. You may have dyspepsia, indigestion. You may have nausea, sensation of vomiting. You may have constipation. You may have reduced appetite. You may feel fullness in the stomach, or stomach may be bloating. When you have infection with Helicobacter pylori, it may be reflected in the form of fever and chills. It may reflect in the form of malnutrition. All the symptoms of malnutrition, anemia and weakness are also sometimes a part of clinical features, that is symptoms. What are the signs of gastritis? Sometimes you may have bad smell from the mouth. You may have vomiting. The patient may have belching, hiccups, occult bleeding, that is invisible bleeding, small bleeding from gastric mucosa, hematochezia, fresh blood from the stool, melena, that is partially digested blood you can see in the stool, hematemesis, you can vomit blood sometimes, and you will have obstipation. Obstipation is the closure of distal part of the stomach so that the stomach will not empty into the small intestine. The main investigation for gastritis is endoscopy. Gastric endoscopy reveals the degeneration or the inflammation of gastric mucosa. It is very important to look into the anatomy and histology of stomach to understand further disease and further physiology of the stomach. So, inner lining of stomach is called epithelium. It contains various cells, but there are three important cells. First one is mucus cells, second one is parietal cells, and third one is chief cells. What is the physiology of gastric mucosa? Mucus cells secrete an alkaline substance which protects the stomach or the contents of the stomach, the lining of the stomach, from the hydrochloric acid secreted by parietal cells, and also the protein digestive enzymes that is produced by the chief cells. Mucus cells, parietal cells, and chief cells. Mucus cells secrete mucus, parietal cells secrete hydrochloric acid, and chief cells secrete pepsin that is going to digest the proteins. What is the pathology of gastritis? It is mainly due to the imbalance of mucus, enzymes, and HCl. When the reason may be anything, if there is an imbalance, it causes gastritis. The next one is Helicobacter pylori. It is a bacteria that releases ammonia and bicarbonates to protect itself from hydrochloric acid released by stomach, and once it reaches the stomach mucosa, it produces toxins which produces inflammation of the stomach. And also the important cause is NSAIDs, non-steroidal anti-inflammatory drugs, or your painkillers. This will directly go and damage the mucus layer, mucosa, so that the stomach will directly come into the contact of hydrochloric acid and protein digestive enzymes. Thus, this is causing that is inflammation of the mucosa of stomach. What are all the causes for gastritis? First one is infection with Helicobacter pylori, consumption of alcohol, smoking, intake of NSAIDs or painkillers, taking iron tablets, GERD, gastroesophageal reflux disease. Sometimes there may be ischemia of stomach. This may be due to autoimmune conditions, use of tobacco, taking of spicy food, irregular eating habits, and also the important cause for gastritis is stress. That is the most important one. What is the conventional treatment for gastritis? It includes proton pump inhibitors like pantoprazole and omeprazole, H2 blockers like ranitidine and famotidine. In case of infective gastritis, you may have to use antibiotics and antacids. This is the conventional treatment for gastritis. So what are the precautions we have to take when you have gastritis? Things to avoid are spicy food, oily food, sour food, salty food, citrus fruits like lemon and oranges. You need to stop eating junk food. You need to stop taking tea and coffee. You have to avoid alcohol, bicarbonate beverages, and also you have to stop smoking. What are the things you need to take when you are suffering from gastritis? Take a lot of leafy vegetables, gourds, and also other vegetables. Include probiotics in your diet. You can take meat but in bland form. You can take pulses but in bland form. These are the things you need to be taking in gastritis. Live a stress-free life. You have to chew the food well before swallowing it. Homeopathic treatment for gastritis. Homeopathy has very good scope in case of gastritis because this is mainly due to stress. We have constitutional treatment to relieve stress, and also we can treat the root cause of the disease. What is causing you? Whether it may be infection, whether it may be autoimmune or anything else, we can cure it by looking or treating the root cause. And also we can treat it through disease specific or local symptoms. When we have local symptoms, we can cure through local symptoms as well. So as I said, it is due to physical, physiological and psychological stress. Homeopathy has excellent medicines to deploy to you in case of stress suffering with gastritis. You can take treatment with us. Online treatment is available, and also in-person treatment or in-person consultation is available with us. Thank you.